Hello, this is Christopher Zachary, and I'm talking about skin tightening in this lecture, which was given at the American Academy of Dermatology in Miami, 2013. My disclosures are that I've worked with the following companies in many capacities. As a consultant, I received some honoraria, and UC Irvine has received various discounts on equipment loans, and study support. I will be discussing some off-label uses. So why are we interested in skin tightening? What are we looking for? Is skin tightening actually what we are looking for? Is this the Holy Grail? There's no FDA indication for skin tightening. And indeed, skin tightening procedures, such as facelifts, do not rejuvenate the skin. As you tighten the skin over a drum, it is indeed extremely tight, but it is thin and inelastic. It has no recoil. It remains dull. It's pigmented and telangiectatic and so forth. So, so maybe skin tightening is a bit of a misnomer. Now, at the Academy meeting, when I presented this talk, I asked the audience to look at the picture of this patient on the left and on the right. I would tell you that most audiences say that this lady looks about 10 to 15 years younger, and I think they're right. And this just shows the economic and social benefits of looking your best, because it made this lady feel really quite different when she walked down the streets. Guys looked at her. It made her feel good at work. She was surrounded by women who were younger and enthusiastic to advance up the chain. And she actually was promoted. She earned more money. So, again, think of the social and economic benefits to looking your best. But the question that I asked was, is the skin tighter? And most of the audience agreed that it was tighter. But again, we're going to examine exactly what we mean by that. The nitrogen plasma device, for instance, different technique. But again, there's obvious improvement in texture and overall appearance, reduction in lentigines, but also the skin looks refreshed, it looks rejuvenated, it looks a little bit tighter, whatever we mean by that. So now I'm coming on to something slightly different. This woman has had reduction of her masseter muscle. If you look on the left-hand side, you can see a rather prominent masseter muscle. On the right-hand side, you can see that's been reduced. Now, just because the bulk has gone, there is no extra sagging skin there. This skin has normal elasticity, and that is critical. Look at this lady. This patient has had ATX-101, the new product from Kythera, which is still under phase 3 investigation. Hopefully it will be available next year. You can see significant reduction in the submental fat region, whether you look on this straight photograph or if you look on the right-hand side in the submental MRI investigation, you can see dramatic reduction in the fat. But again, looking at this patient, there is no sagging skin there, and it's because of the normal elasticity. So what's the point that I'm making here? The point is that tight skin has to involve somehow the concept of elasticity, either maintaining it or inducing new elasticity. And there are some devices out there that can induce elastic tissue. So youthful skin is texturally smooth, has natural tone, and I would say exhibits some plumping. John Voorhees out of Michigan has demonstrated that fibroblast stretching is beneficial. It sustains collagen production, and it's also important to remember that the youthful skin is elastic. There's resistance to pressure, deformity, and gravity. And so some people think the answer here is to get rejuvenated, tighter skin, that we should induce volumetric reduction, and we should fill the skin actually either naturally with devices that can induce more elastin, more collagen, or whether we should just simply inject with dermal fillers. Either way, it's going to make the skin look rejuvenated and somewhat tighter. Well, I will tell you that combination therapy wins here. Fillers are great, toxins are very good, topicals, as I'll demonstrate in just a few minutes, retinoids, sunblock, hydroquinones, moisturizers. In fact, I only really believe in about 4 or 5 things. I don't believe in antioxidants. I don't believe in the great bulk of the botanicals that are out there. I think there's very little evidence that they do a whole lot. But in practice, judicious combination of all the 3 above with lifting procedures is going to be required for those patients who have very extensive tissue sagging. So this is a picture that I received from Emil Tanghetti. Thank you, Emil. Before and after, left and right, and you can see this patient has had 6 months worth of topical retinoid. And it's a dramatic improvement. The skin does look tighter, but I would suggest to you that actually there's been plumping of the dermis, there's new collagen formation that's been demonstrated probably 20 years ago now. The color, texture, tone is better. So we can do a lot of things with topical agents. This is a patient of mine. I was discussing with a certain representative from a microdermabrasion company my opinion that microdermabrasion didn't do anything. So she said to me, well, why don't you just try it? So this patient had 6 dermabrasion treatments at 2-week intervals, and I got to say, she looks a lot better. She's delighted. The costs for this are significantly less than many of the costs that we have for rejuvenating procedures. So anyway, there are many ways of getting to where we want to arrive, but the question that I would like to give for you all here is, can the devices out there that we're using, can they target relevant zones for tissue tightening? And these could include really any of the following. The epidermis, to a certain degree, the dermis for sure, underlying fat, fascia. I don't think nerves are going to be terribly important here, but who knows? Muscle or bone. We all know that the loss of fat, muscle and bone are very important in the skeletonization process that goes on during life. And if there's some way of maintaining the amount of underlying structure, the fabric that is our skin, will be better supported if the bone, muscle, fat and fascia and dermis are maintained in their youthful quantities and volume. So intense pulse lights can be very effective for rejuvenation, but do they tighten the skin? I would say not much. In fact, I don't think that IPLs, intense pulse lights, do a whole lot for tissue tightening. I don't think they induce much in the way of new collagen or elastin. However, they can make a dramatic improvement on the appearance of the skin. What about fractionated 1550? I think that you can see again the picture from, if you compare the left, this is Dr. Zachary Rahman photograph, compared with the right. Most people would say there's been some tissue tightening, and we know from histological studies that there is an increased collagen deposition and probably increased elastin deposition as well in this patient. So I want to share with you this series of photographs, because this woman, you can see, has a lot of laxity in the submental area under the chin. Now this is one of my patients, all right, that I treated, and it's definitely caused tightening of the skin, but you can see there's almost there is too much. There's a scar there, a vertical linear scar. This was in the days when we just started doing this treatment, and we have changed our techniques somewhat, particularly with regard to bulk heating. If you look at this infrared image, the thermal camera, up at the top left here, you see the picture of the face, and then the black thing, the square thing at the bottom right is the scanning device, the fractionated ablative scanning device, and then in the middle you can see where we've scanned from top to bottom. At the top it's green, at the bottom it's white. That's about 42, 43 degrees. So if you keep on scanning up and down in that region, you will lose the selective heating that is such a feature of fractionation, and you will simply get bulk heating. And I have seen in patients, I have seen full thickness skin loss. This is a technique issue, so be super careful to avoid bulk heating. Scan in one area, move to the next. You can always come back later in a minute or two when it's cooled down. So this is one of my patients who's had 2 treatments with the fractionated ablative laser. And again, you can see that there's extensive improvement in the laxity around the mouth, around the eyes. Is this tissue tightening? Well, again, I would suggest to you that there's been some volumetric reduction, because we blow off a fair amount of skin here. In the healing process, there's been a lot of new collagen and probably new elastin formation deposited here. In this image, you can see there's a very nice picture of the patient, and behind we're actually showing that we have these images available. They're available on the web, on a web-based process, so that we can pull these up wherever and whenever we want. So we can show to the patient before and after images, which are so important. You need great images so that you can show to the patients exactly what they looked like before. Now, focused ultrasound, the Althera technology is very interesting. You can put focused ultrasound pretty much exactly where you want it in the skin, high up or deep down. You can hit the fascia, you can hit muscle, not that you probably want to, you can hit the dermis, and so there's been some nice evidence here. If you look at the slides, these are not my patients, but if you look at the patient at the top, for instance, on the left before and afterwards, look at the upper eyelid, you can see pretty dramatic elevation there of the eyelid and the brow. And the lower images, you can see nice improvement of the upper eyelid. You can see that there's a distinct margin of increased space between the lash line and the orbital crease, the eyelid crease there. So radio frequency is another technique that we use for tissue tightening, so-called. This is the monopolar device by Salter, the Thermage. Monopolar as opposed to multipolar. So this is work done by Vic Ross, and this demonstrates that within a short time, namely about a millisecond, a lot of the vertical fibrous septi have been coagulated. They've been shortened. They actually changed color here. Can you see the darker pink color means that the coagulation effect has occurred, and the tissue has been tightened in a vertical orientation. Of course, when we use the Thermage, we're actually treating patients for at least a second as opposed to a millisecond. So this is a very early event. Also, there's been a lot of very good information out there pertaining to upregulation of various growth factors, such as transforming growth factor, beta-1. You can see here, this is the control on the left, then 7 days and 30 days in 3 subjects, marked increase in TGF beta-1, also for collagen 1 and collagen 3. So there's some good science behind the use of these radio frequency devices. This is a patient who has had the right side of her face treated. You can see both straight on and from the vertical shot on the right-hand side, there's prominence of the right side. It's been rejuvenated, it's been tightened, and that was maintained for months and months, over a year actually. Now, I'm putting this slide up here because a lot of continuing medical education groups and others are concerned about privacy. Of course, we have to be concerned about privacy, but I would just say if you know the individual, then you know that this is Mother Teresa, whether she's got her eyes covered or not. And likewise, in this young man, everyone knows who they are. So remember this: if you know the patient, then you know them. If you don't know them, you're not going to know them, whether you have the eyes covered or uncovered. But anyway, just for the to comply with various regulations, I'm covering up the eyes here, and I want you to look in the submental area. This is baseline and 4 months after treatment with the Thermage device. Very nice tightening in this region, probably some reduction in fat as well. And you can see that the skin probably has some natural elasticity, which makes it recede back into that concave area, which is a nice result.